Hi, I'm Anthony Llewellyn, experienced senior boss in medicine and medical HR expert. Um, I've started this series, Bad Bosses in Medicine, not because I think the majority of bosses out there are meaning to be bad or bad in the sense that they're acting in a very malevolent way in the system, but and in fact, I think most senior doctors like myself are well-meaning and care about both the patients and the people that they work with. But I think we just have to acknowledge that medicine has a dirty little secret, and that secret is that most senior doctors are, at the best of times, sub-average managers. Um, there are very few really good, effective managers out there in medicine. And sadly, there are lots of cases of really bad managers and bullies and people that really should not be in a position to be looking after trainees. And we see lots of evidence of what we call the bystander effect in medicine, where others just walk past bad behaviour or don't really have the skills or feel like they've got the emotional energy to tackle bad behaviour, and that just percolates the system and leads to some of the problems that we've been seeing lately. So what I'd like to achieve in this series is talk about why I think there is some problems with management in medicine, what I think some of the reasons for that is, what the consequences are, what some of the potential solutions are, because I don't want to leave you senior doctors out there particularly, or trainee doctors who are eventually going to become a boss doctor, without any skills or ideas about what you could do to avoid being known as a difficult or bad manager or bad boss. And also just talk about how particularly trainees can own the difficult boss situation. Difficult bosses come in all manner and shapes and sizes, and there's usually a reason, and there's usually a way of what I call empathizing or sort of attuning yourself to the reason why you might be struggling with a particular boss. Sometimes you might struggle with a boss when others don't. And so how can you own that situation? How can you take control? How can you make sure you as a trainer get what you need out of it? So we'll talk about some tips and strategies and try and individualize them towards different types of bosses in medicine. I wanted to share a personal story. Now, look, I've fortunately never been in a situation where I felt like I've been bullied or harassed or really treated badly as a trainee in medicine. So that's been good for me. I've certainly seen that situation and heard about that situation for other people. And I've certainly had challenges with my bosses. I recall to this day an episode many years ago now. I was a trainee psychiatry registrar. I was coming in on the morning in the local hospital. I used to go to the emergency departments and see the patients that had sort of been collected from the day before. And I think I was sort of writing up a patient I'd seen. And I glanced over to my left and I saw that there was a group of surgeons collected around the patient list. And there was a senior surgeon and a couple of trainee or registrar surgeons in the group. And one of them had been on overnight covering all the patients that were coming in, was clearly tired, and the other was sitting there, getting a handover. And I remember how belittling that experience for the overnight registrar seemed to be. The consultant was raising their voice, was making it quite known that they weren't happy with how they'd assessed patients and what they'd done with patients, and really in a very public way in an emergency department, tearing shreds off this poor trainee who clearly had been going at least 24 hours without sleep. And I was uncomfortable. And to this day, I regret doing nothing about that situation. I watched, I observed. I chose not to walk over and observe the bullying behaviour. I chose to do nothing later on in terms of providing some support for that poor trainee. There have been situations where I have stepped in as a bystander since, but I still to this day regret not stepping into that situation, because if we as bystanders don't address bad behaviour in medicine, then who is going to? So hopefully we'll talk about that as well during this series. So I mentioned earlier that I wanted to talk a little bit about why I think there is a problem with bad bosses in medicine. And the first, I want to talk about one reason today, and that reason is actually more of a global reason. Actually, if you look at the literature, and I am someone who's studied human resources quite a bit in my role. I'm a bit of a nerd in that sense as a doctor. I actually like doing things like managing and looking at best practices, recruitment, and etc. Um, and if you look at the literature, if you look at the literature around good and bad management, actually every industry has this problem, and successful companies like your Googles, etc., know this, and they focus on talent management of management. They encourage managers to adopt best practice because they know it leads to success, it leads to profits if you're in a profit industry, or it leads to good outcomes if you're in a public sector industry. But most companies in all sectors really struggle with this issue. And so if you look at it, things like employee survey instruments, and there's one particular internet survey that looked at 200 odd employees asking about their experience with bosses. That survey showed that only 34% of those workers would choose to work with their boss again, given the chance again. If you look in our own sector in New South Wales, if you look at the last People Matters survey, only 45% of employees in New South Wales Health rated their senior managers as favourable on performance, i.e. that means over half of the people that responded to that survey felt that senior management wasn't doing a good enough job in terms of their role. So it's not just doctors that struggle with management. It's not just doctors that struggle with being bosses. And that makes sense because, we're generally intelligent. We like reading. We like learning. We like development. Management is hard. And if you don't dedicate some time and effort to it, then you're going to practice it badly, or practice it the way you think it should be, but actually do it the wrong way. And look, generally we get poorly trained in the art of management or the science of management. And that's some of the other reasons that we see the problems with difficult or bad bosses in medicine. And I think that does have consequences. I think it contributes to some of the issues as to why trainees feel stressed, not listened to, de-energized about coming to work, etc. at times. Because if you think about the things that stress you at work, it's often what you think your expectations from your boss is, what they want you to do. That's one of the things that really can affect the way you think and act at work. So look, that's enough for me today. I'm hoping to make this a regular series. I'm hoping to open it up to some discussion. So I'd really love to hear some stories from you about both examples of good bosses as well as bad bosses or difficult bosses in medicine. Share them with me in the links below. We'll choose some of those and we'll dissect those stories. I think it's going to be helpful to look at case studies, talk about the different types of difficult bosses, some of the reasons behind difficult boss behaviour, and what you as a trainee might do about that. And also, as I said, come back to some of the keys I think that, how we all can learn to be better managers in medicine. And it's not too late for anyone. Actually, you've got a lot of skills there already. It's just about tuning into them and adapting them for the management role. So thank you for listening, and I hope that you choose to subscribe and get involved. Check out the links to the websites, site that I've established, and the kind of community course that I'm developing on this as well. I'd love to get as many other people who are passionate about this issue involved, because I think it is a big issue in medicine.